Despite a drop in case numbers, COVID-19 is still here. WDRB's Darby Bean explains the impact a local health leader says at-home test kits could be having on the data. Darby?
Hayden, a doctor we talked to today, says those at-home tests may not be showing what case numbers actually are and may make them look lower than they really are because people might not report those results. But from those we talked to today, they say there are fewer people in the hospital. After years of living in this pandemic through the waves of different variants and spikes in cases, health experts are taking a breath.
The emergency departments, we're not seeing, a significantly amount of, positive cases or critically ill patients or anything like that. So overall, I'd say activity is pretty low still.
Clark County, Indiana Health Officer Dr. Yazel says the demand for COVID testing at the health department has recently slowed significantly.
We were seeing pretty consistently less than 20 a day now. And we used to max out, 250, things like that.
He says at-home test kits could be keeping some people away from the lines at public test sites. And while he says testing at home is convenient, it can also skew the numbers if people don't report positive results.
But it does pose a challenge as far as being able to have solid epidemiology numbers and things like that. So I do think that probably new cases are underrepresented.
Still, he says the main concern would be a rise in people going to the hospital, which he's not seeing.
So we are watching our hospitalizations and ICU usages and things like that, and we aren't seeing a climb there.
Norton Healthcare says as of Wednesday, there were 10 people hospitalized with COVID, including one person on a ventilator. A Norton spokesperson says none of those patients originally came to the hospital because of COVID, and instead, it was an incidental finding. Maps for southern Indiana and much of Kentucky showing low community case levels by county. Dr. Yazel says he thinks the cases we're seeing now are most likely that BA.2 Omicron subvariant. We asked Norton Healthcare about seeing any spikes after spring break, and we're told it'll likely be another week before we see any data from that. Darby Bean, WDRB News.